This is the first CEO position I've had, but having been chief of a couple of divisions and the director of the Strength program has been a good warm up for this. So I get to have a say in the direction for all the different specialties with obviously input from, we have a fabulous team here. And I do that half-time or 50%, and then I'm approximately 50% clinical. So I see patients 1 to 1.5 days a week, and then I operate 1 day a week. I would miss not being able to do that. It's meant that I had to sort of focus my clinical work. So now I'm really just seeing patients with scoliosis and taking care of trauma patients, so kids that break their arms or legs or things like that. But I've referred some of the other kind of conditions that I used to take care of, like pediatric sports injuries and things, to some of my other partners who are experts in those areas. I miss those things a little bit, but I also find that the work on the bigger picture, like how can we do a great job taking care of all kids that need specialty care, that's been really interesting to me and a really big learning curve. So I think for me, it's the best of both worlds. I still get to see patients and try to have a positive impact on patients' lives and how they do with their condition, but I've limited it to the condition that I have focused my career on, which is scoliosis. The relationship between patients and doctors is different than it was when I started training. What patients wanted was to sort of be told what the best answer is. And informed consent, which means you explain all the pros and cons of a given treatment option to a patient, was different than I think people tended to say, we're going to do this, it's going to be great, don't worry. And that was really comforting to people. But I think today it's important that people understand, parents and patients, when they're old enough to understand what we're talking about, understand the pros and cons of a variety of treatment options. So I can tell them what I think and what I would do, what my recommendation is. But when I do that, I want to be really careful to make sure they understand why I think that, what I think the short-term benefits are, what I think the long-term benefits are, and outcomes, maybe the long-term negative consequences that are possible. And most importantly, that they understand what would happen if they didn't treat it versus did treat it. So if I'm recommending surgery for somebody who's got a 60-degree curve, you have to understand, well, why am I saying that? Because I know that 60-degree curves will almost always get bigger. And I know what happens when those curves get bigger. And so I make sure that parents understand that. I think it's really important that families, parents, and patients really own their part in the decision and make the decision themselves with information from me rather than me just saying, this is what you should do. I tell them this is what I think is best and why, but they've got to make that decision. And the more they own their results too, it's really important for patients to own their part in the treatment. If you don't wear your brace, the brace isn't going to have an effect. It's important to understand that. One of the things that we've done that I think is really helpful and that we're looking to do here in Northern Virginia, I don't believe we're doing and anybody's doing it yet, but is to monitor the brace, which sounds a little weird. So they put a little basically sensor in it that can tell you and the doctor how much you're wearing it and how many hours a day you're in it. That's basically feedback. It's not a microchip that it sounds a little bit like Big Brother, but it's really important feedback, because if the patient understands how much they're wearing it and what that means in terms of their likely result, I think then they have that, they own their part of it. We know that with bracing, if you're not wearing it some sweet spot amount of at least 16 hours a day, it's somewhere probably between 16 and 20 for the full-time braces. We know that less than that, 12 hours a day, 10 hours a day, really isn't a good outcome, doesn't affect the outcome enough to make it worth the trouble. So you have to be wearing it that certain amount at least. And getting that feedback from those brace monitors, they're called compliance monitors, can be really helpful. And then we know what's going on. So if the treatment isn't working, we have an idea that might be part of why. And the patient understands, look, you're doing really well because you're wearing it a lot, or we don't see much of an effect of the brace because you haven't been wearing it very well.